spoke through me, so I think I was on mute.
So, okay. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Tasha Sizemore, and I welcome you to this public hearing to discuss the division's preliminary rate decisions for 2023 health benefit plans. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to the discussion of the division's preliminary decision and final objections regarding the filing. During this hearing, carriers will provide information on their plans, including network and benefit changes, and are permitted to defend their rate assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is how much of every premium dollar goes to pay healthcare claims costs, to ensure that the requested rate is not projected to trigger federal rebates or payments from other federal programs. The recent history of rate changes, and the overall financial strength, including the profitability, investment income, and surplus of the company and the administrative costs. Division staff also ensure the filings meet all the requirements of the Affordable Care Act and determine if the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate hearings for all of the companies on our website, www.oregonhealthrates.org. And our communications for every health rate change filing, including written answers to all of our questions asked during the rate review period, are posted as well. In this hearing, we are discussing Samaritan Health Plans, Inc. And our agenda will be a representative from Samaritan will make a presentation regarding and describing their rate request. The division staff will lead a discussion about the preliminary decision on the filing. And finally, we will accept public testimony. If you would like to make a comment on the company's filing, please unmute yourself at that time, introduce yourself, and make your comment. Comments will also be accepted online through 11:59 p.m. on January 28th. The division will make a final decision about these rate filings shortly after the public comment period ends on July 28th. Samaritan, please begin by introducing yourself and explaining your rate requests.
Yeah, hi there. Again, this is Trent Deegan, Director of Finance for Samaritan Health Plans. I am not sure if we got Kelly Grabinski from our actuary. We're having some difficulty connecting with the phone and Teams. I'm not hearing him speak up, so it might just be me. So I will go ahead. Would you like me to present our filing?
Yes, please. Yes, please. And if you have a presentation that describes the benefit changes, now is the time to do that.
Okay, excellent. So I'll briefly go over our filing. So Samaritan Health Plans serves the Willamette Valley and Benton, Lynn, and Lincoln counties for a small group product. For 2023, we have an average rate increase of 4.3%. This ranges from a minimum of 1.6% to a maximum increase of 5.5%. Quarterly increases were based on an annual trend rate of 6.1%, which corresponds to roughly a 1.5% increase per quarter. These rate changes will impact a very small population. We have 78 members in our small group members across our 15 different plans. For 2023, we made some minor changes to the plan design offerings, really just around deductible and out-of-pocket levels to make sure we're meeting metal level tiering standards. We continue to offer the same 15 plans on the EPO network in these three counties located in ratings area 2 and 5. Our plan offerings are still along the same lines as 2022. We are offering silver and bronze plans. We also offer 2 silver and bronze high deductible plans as well. And to determine rates in 2023, really, again, a lot of the benefit packages are very similar. We apply trend factors based on our recent plan experience and revised expectations for 2023. We also have some plan adjustment factors to account for the effects of healthcare trend and leveraging some of the more fixed costs of the plan design components. That concludes my presentation.
Thank you. Now we will hear from division actuaries that will lead a discussion about the division's review of the filings and our preliminary decisions. So I don't remember, is that you again, Drew? And if so, please introduce yourself.
Hi, my name is Drew Bucks. I was the primary reviewer for this filing.
My name is Michael Sink. I am a secondary reviewer for this filing.
And so for my presentation today, I'll start with a high-level overview of the review process that we go through for this filing. Then I'll go into a little bit more detail on some of the more important factors. And then I'll wrap up with the preliminary rate decision for this filing. And so on a high level, our review process, we focus on three categories: the data and experience, the assumptions, and the calculations. The data and experience serves as the starting point to get to the 2023 projection period. We review the data and experience for the appropriateness and reasonability. And in this instance, the Samaritan small group has very low credibility. So the self-insured hospital experience is used in place of that. And so there are several adjustments that are used to bring that back down to the commercial small group level. And I'll talk about that in just one second. And so after reviewing the data and experience, we had no issues with what they were used, what this company was using. The assumptions, which are used to adjust the base period data up to the projection period, so from 2021 to 2023. In this instance, there are also other adjustments from the self-insured hospital experience to the small group experience. And then other major assumptions are the trend and risk adjustment. And I'll go more in depth on these in a few moments. And then finally, the calculations, which takes the data and assumptions and creates the 2023 rates. We review these to make sure that they're appropriate and accurate. And after review, we have no issues with the calculations. Moving on to the assumptions, the trend, which is made up of the medical inflation or cost and utilization, as well as prescription drug assumption, which is a smaller portion. We reviewed the trend assumption for this company by itself, supporting documentation. And we also compared it to other carriers in the market and found that it was within a reasonable range. The next part that I'll talk about is the risk adjustment, which is another mechanism to help stabilize the market, dealing with the morbidity of the market. In this instance, there is no risk adjustment for this company. It's very small. We also reviewed the final 2021 numbers from CMS, which we reviewed and the company did, and they're proposing no changes to their assumptions. And then one other factor that I'll mention is the COVID factor. The base period for 2021 included some higher utilization due to the delayed services from 2020. We reviewed the assumption for this company and the supporting documentation, and also compared it to the other companies in the market and found that it was reasonable. And so finally, the preliminary rate decision for this filing is to approve as filed. And thank you for your time.
Thank you, Drew. Back to Samaritan. Do you have any additional information or comments that you would like to make on these filings?
We appreciate the opportunity to continue to do business in the state of Oregon as a small group market. So thank you.
Thank you. So we will now take public testimony. I don't believe anybody has signed up to testify, but if you would like to testify, please unmute and introduce yourself. Okay, let me remind anyone listening that July 28th is the last day for public comments on these filing. Comments can be submitted through our website at OregonHealthRates.org. Thank you, and that concludes this morning's scheduled hearings. We'll be back this afternoon for a couple more carriers. So have a great morning, and we'll see you later.
Order.